Hi, this is Dr. Harry checking in to see how you are doing this Monday, the start of another week, and hopefully to bring you a little bit more information on the ongoing fight against COVID-19, the current epidemic. Over the past few months, and even more recently, in the past few weeks, we've been asked to make significant changes. Our schools have closed. We are now working from home, and there have been so many changes in an attempt to combat this epidemic. And this includes the recent CDC recommendation of wearing face masks, voluntarily recommendation currently for everyone. However, some states and counties have mandated the wearing of the mask. But today, what I wanted to talk to you about was possible interventions for someone who is already seriously ill. And that is why I wanted to talk to you about convalescent serum. Maybe if you've been listening to the news, you've heard the term convalescent serum and you've been wondering, what is it? And how does it potentially work? Well, convalescent serum, what that really means is using the serum of a person who is recovered from COVID and injected it into a person who is now seriously ill with that disease in an attempt to help their bodies to fight off this infection. And this is not a new therapy. It has been used for many, many decades, and it's even been tried in the first SARS infection. And there've actually been some success with this therapy in the past. But the question is now, will this work for COVID-19? The good news is many universities, major universities, are now taking on this study, and they're really wanting to answer this question for all of us. There has been some recovery using convalescent serum. But again, studies need to be done to ensure that it does indeed work. So there is light at the end of the tunnel, and hopefully this can be a bridge in between what is going on now until we develop vaccinations and other viable treatments. We've had our own little recovery story here in Orlando, and you can check out the news if you wanted to see the Orlando news on that. But I wanted to keep you up to date on what's going on currently, and I will continue to do so. And if you have any questions, please feel free to DM them to me. Until next time, this is Dr. Harry. Bye-bye.